copycats.com.
Welcome back. We are learning more about the shocking death of designer Kate Spade, the fashion icon found dead in her New York home where police say she died from an apparent suicide. The 55-year-old being remembered as vibrant, colorful, and most of all fun, just like her famous handbags. Her death surprising many today, and we're going to go beyond the headlines, taking a closer look at suicide prevention and mental health, the warning signs, and what you can do to get someone help. We welcome in Dr. James O'Day from Hartford Healthcare Behavioral Health Network. Doctor, this is kind of the new frontier, and we mourn the loss of Kate Spade, but this really calls attention to mental health issues, the stigma attached, and maybe kind of getting ahead of this as we do physical conditions.
Yeah, I think that's exactly right, Kevin. Excuse me. Whenever a large public event like this happens, it provides us an opportunity to talk about what is a very important issue that often isn't talked about as much as it needs to be. And if we use this as an opportunity to actually bring awareness to the signs and symptoms that someone may be contemplating ending their life, they may be thinking about suicide, that provides an opportunity for us to actually get ahead of this issue, provide some screening and treatment.
We all have bad days. We all have mood swings. How do we, in our lives, with our family members, close friends, people in our workplace community, differentiate a bad day versus warning signs that there could be a more serious mental health issue?
Yeah, well, I think the first thing is we need to talk more about it. We need to be more frank. We need to be more open about these issues. One of the things that I know nothing, of course, about the Kate Spade issue in particular,
sure,
but what is very common in completed suicides is an insufficiently treated psychiatric condition, most often depression. And so people who are struggling with depression really need to continue to recognize this is a medical problem, just like hypertension, just like diabetes. If people receive care and treatment for these kind of conditions, we really go a long way towards making suicide potentially preventable.
And care and treatment, we're talking about maybe a combination in some cases of and medication.
That's exactly right. Most people benefit initially. We usually start with a little bit of talk therapy. People should talk to their primary care docs. You know, I often say if you're talking to your primary care doc about your orthopedic issues, your cardiovascular conditions, you should be talking with your primary care doctor about your behavioral health conditions as well. And if we get someone engaged initially in care and treatment, do good screening, put behavioral health clinicians in our primary care offices, all the things that we can do to improve access, we continue to provide better care and treatment and make this a less common phenomenon.
Specific risk factors we should look for, and then what we can ultimately do, whether it's for ourselves or for someone we care about.
Yeah, well, one of the things that we have to highlight is how common these issues are, right? We know at any given time there's probably 18 million people in this country who are struggling with depression, which can lead to a completed suicide. Less than 30% of the people who are dealing with those conditions will get care and treatment. So when people are talking about experiencing symptoms where they feel down all the time, they're feeling tearful, and you hear that from friends and family and other, we really want to encourage people to say that's an opportunity to go seek help and assistance because treatment works.
And we're looking at some of the warning signs for suicide. If you or someone you know needs help, you can certainly contact the National Suicide Prevention Lifeline at 1-800-273-TALK. That's 8255. It's free and available 24 hours a day, 7 days a week. As we wrap up, Dr. O'Day, there have to be many stories of people who've conquered mental illness. We're talking about Kate Spade today, but there are many happy endings to mental health issues and possible suicide situations as well.
It's absolutely true. At Hartford Healthcare, we really focus our perspective on recovery. We recognize that these conditions, just like every other medical conditions, people recover all the time. So we have to use these opportunities to improve awareness, improve access, get people care and treatment, because you're right, this circumstance is a terribly tragic outcome, but the vast majority of people who get care and treatment get better.
This is the next frontier in healthcare in America. I mean, we focus so much on the physical, mental health from the neck up. We've got to pay more attention. Yeah. Doctor, we could keep going. We really appreciate the conversation.
Thanks for the opportunity.
Up next, partly sunny skies right now out there, Josh.
Yeah, and there's a